Closely following the President and First Lady's COVID-19 diagnosis. Our thoughts and prayers continue to go out to them and their entire team at the White House as they keep our country running while managing their own health. It's, however, a good reminder for all of us that none of us live in a bubble, not even the President of the United States. COVID-19 has the ability to reach all of us, which is why we've taken this virus seriously since the first day that it came to Iowa. But the President is also right. We can't let COVID-19 dominate our lives. And that's exactly why we've taken the steps we have these last 7 months to balance both the lives and livelihoods of Iowans, from managing our healthcare resources to slowing down the spread of the virus to protect the most vulnerable, to keeping our schools open and our economy and lives moving forward. And that's why we must continue, and that's what we must continue doing as community spread affects areas of our state. You know, last week I spoke about the increase in virus activity and community spread occurring in northwest Iowa and other rural counties across the state, and that does unfortunately continue to be a trend this week. We're also seeing an increase in hospitalization as a result, especially in northwest Iowa, where hospitals across the region are experiencing a rise in admissions. Yesterday, we reached an all-time high of 444 Iowans hospitalized across the state. And this is disappointing news, and sadly, it's what can happen when we are experiencing community spread. So even though positive cases are more evenly distributed across age groups in many areas where virus activity is high, it's the vulnerable population that remains most impacted. In the last 14 days, 72% of all individuals hospitalized are over the age of 60, and 68% have pre-existing health conditions. Yesterday, my team, and I know the Department of Public Health is also doing this, but my team spoke with healthcare providers across the state to better understand the situation on the ground. They assured us that they're able to manage the capacity and they have the resources that they need, and most importantly, that they're prepared. I have said this several times, but the unprecedented coordination and collaboration between our healthcare systems has really been impressive, and it is allowing us to manage these increased numbers. So after 7 months of treating COVID-19, our doctors, nurses, and other healthcare professionals are experienced in treating the virus, and they now have access to new therapeutics and different treatment options to help patients recover sooner. So even though the number of Iowans hospitalized is the highest it's been, we've not approached the peak of our hospital capacity. Our healthcare system in Iowa is strong, and for that we are grateful. Last week, the Iowa Department of Public Health issued updated guidance for visitation and testing at long-term care facilities. And one of the most heart-wrenching consequences of COVID is the isolation and separation it's created between the elderly and their families and neighbors. The steps taken back in March to protect the safety of both residents and staff of long-term care facilities were necessary and appropriate. As we witnessed firsthand, when an outbreak occurred in a long-term care facility, it was devastating. And that's why these steps were so important as we learned more about COVID-19. But the wall that we built to keep COVID-19 away from our most vulnerable seniors also kept out the loved ones who provide them with the day-to-day support that they need and the person-to-person interaction that means so much to them. The Iowa Department of Public Health's revised guidelines are in line with the federal guidelines and provide clear opportunities for visitation and communal activities. They also expand criteria for compassionate care visits and support a very robust testing strategy for residents and staff of long-term care facilities. Our state agencies are also working on ways to support the efforts of long-term care facilities to enable more flexibility, more flexible visitation options that brings families back together safely. Today, I've invited Tabitha Jaden, administrator at the Dairy Suites at Western Home Communities in Cedar Falls, to share some of the steps they're taking to keep families connected. Tabitha?
Thank you, Governor Reynolds. As Governor Reynolds mentioned, over the last 7 months, we've had to make adjustments to adjust to this pandemic. In the beginning, we were solely focused on protecting everybody that was in our buildings, and as time has gone on, we've learned more about the coronavirus and are able to bring some of these things back. We're very excited about the new guidance that was released surrounding visitations. This now allows for more visitations, but still we have some limits to follow. These new visitations bring so much joy and happiness to our residents as well as their families. With the new guidance, the definition of compassionate care visits was expanded. It's not considered for just end of life. It's for residents who are struggling with into the nursing home, or maybe a resident who had a recent death of a friend or a loved one, someone who is maybe declining or sad and tearful. And these visits can be for family or friends. For us at the Dairy Suites, we have previously expanded our definition of compassionate care visits. And it's amazing to see the joy and the contentment and the delight that this brings to our residents. The first visits did bring some tears of joy and excitement, and several of our staff also shed a few tears just to see the joy that it brought to the residents and their families that they too care so much for. We're still taking steps to mitigate the risk. We do monitor the county positivity rates very closely to make sure to determine our frequency for our staff and resident testing. If positivity rates in our area are above 10%, we do have to limit some of the visits, but we are now able to continue the compassionate care and outdoor visits. If there's new cases of COVID-19 among our staff or our residents, we do put a few more limits on those visits until baseline testing is completed over a 14-day period. But again, we can continue with those compassionate care visits and outdoor visits. With the new guidance, we also have to limit the number of visitors in a building that come in at one time. And we're still trying to do outdoor visits because they're strongly encouraged due to the decrease in possible exposure. But as winter comes, we're actually, at my facility, we're creating indoor visiting areas that can be utilized in the very near future. The second part of this new guidance that's really exciting is that barbers and beauticians are able to come back into our buildings. So it's amazing to see like the smiles on residents, from ear to ear when they're able to get their hair cut and set again. They look so much nicer. We know that the residents and their families are just as excited about this new guidance as we are, and we cannot wait to hear more positive stories about how these visits from other facilities and other residents and their families in the near future. So thank you.
Thank you, Tabitha. And the work that you and your team are doing is so important for your residents' quality of life and the peace of mind of their families. So really thank you for all that you're doing and the care that you're providing for your residents. And thank you so much for joining us today to share what the steps that you're taking at Dairy Suite. So thank you very much. I appreciate that. So last week, the president announced that 100 million Buy Next Now test kits, a new COVID-19 antigen test, would be supplied to states across the nation to further increase access to testing. Since then, the first shipment of more than 60,000 tests have arrived at the state hygienic lab. Dr. Pintella and Dr. Padati, along with my team, have been finalizing the distribution plan to get these kits out to where they'll have the most impact. As I mentioned last week, we will prioritize these tests for hospitals and medical clinics in rural communities where there is less access to testing. Healthcare providers are not only best equipped to administer the test, they'll also be able to check in with patients on their overall health and schedule any care that may have been delayed since the start of the pandemic. Another final detail that's being worked out before the test kits are shipped to providers later this week is how the results will be reported back to the state. When point-of-care antigen tests were provided by the federal government directly to the long-term care facilities for routine testing of staff, there really was not a good mechanism in place for them to easily report results to the state. So the Iowa Department of Public Health has since created a tool to make reporting possible for these facilities, and is doing the same for other healthcare providers that don't otherwise have access to the state's electronic lab reporting system. This will allow us to continue to track all tests being used across the state, which is increasingly important as test types and volume continue to grow. We expect that the availability and use of rapid point-of-care antigen testing to increase significantly in the coming weeks and months. With the Binax Now test alone, Iowa could see an influx of as many as 900,000 additional tests in the state. And again, this trend will only continue as new tests are developed and distributed in the market. The level of antigen testing happening even now is already beginning to call into question whether changes to our reporting practices may be needed. So since August 27th, when we first began reporting antigen test results, 84,679 antigen tests have been included in our data. That's more than 2,000 per day for the last 41 days and more than 14,000 a week. For some time, our reporting has been based on the number of individuals tested. But as access to testing has increased, so has the number of Iowans who've tested multiple times. And with rapid tests now becoming readily available, the frequency of testing per individual, it really could skyrocket. So today, approximately 833,000 Iowans individuals have been tested for COVID-19, but more than 1.3 million have been conducted in our state. And so that's a difference of nearly 500,000 tests. As regular testing among individuals becomes the norm, reporting the total number of tests instead of individuals tested may become a more useful indicator of current virus activity and more in line with how we monitor other respiratory viruses like the flu. So Dr. Pradati has brought this issue to our attention, and I've asked her, along with her team of epidemiologists at the Iowa Department of Public Health and members of my team, to look at this more closely and bring their recommendations back to us next week. Since the beginning, we've had to adapt as new information and innovation becomes available, and we should expect that change will continue to be necessary as circumstances and our response to them evolve. As I've told Iowans from the start, we're committed to keeping them informed and being transparent with our data. If reporting changes are warranted, we'll explain why so that Iowans know that they can continue to trust and rely on the information that's provided by the state. I'm proud of the testing programs that we have here in Iowa. The CDC has ranked Iowa 25th in the nation for test perform and 17th in the country for test per 100,000. We are exceeding the goal of tests per 100,000 at both the regional and the national level, according to the weekly COVID-19 report from the White House. And our testing capacity only continues to grow. In fact, next week, we're opening 2 new Test Iowa clinic sites. One will be at Winneshiek Medical Center in Decorah, and the other with Wapello County Public Health in Ottumwa. We're also transitioning the current Buena Vista County Test Iowa drive-up site in Storm Lake to a clinic in partnership with BV Regional Medical Center to continue to serve the community. And finally, as I wrap up, I would like to end with some good news. Today, the Iowa Business Council released its third quarter economic outlook survey for 2020, and the overall economic index rose to 58.71, increasing 17.46 points since last quarter. And it's the first time since the fourth quarter of 2019 that the index has been above 50, which represents significant optimism about Iowa's economy. And this follows up on the Iowa Associated Business and Industry survey of their members, which also indicated that Iowa manufacturers expect strong results in the fourth quarter, 47% of those responding expect sales to expand, and 57% plan to make capital expenditures. So that's some good news that hopefully the economy is recovering, we're moving in the right direction, and we can start to see some positive things continue to happen in our state. And with that, we'll open it up for questions.
Yes, thank you, Governor. Regarding hospitalizations reaching a record yesterday evening, do you expect things to get worse before they get better?
Well, I hope not. It's indicative, I think, of what we've seen with community spread. It's more general population. Prior, when we hit our high of 417, a lot of that was tied to some of the nursing home outbreaks, some of the other outbreaks at some of our manufacturers. So right now, it's more general population tied, I believe, to community spread. But I think, the main takeaway needs to be the team, we're on the phone every day with them. So the outreach and communication and coordination has been exceptional, asking if they need anything, is there anything that we can provide, and they're indicating that they're doing fine, PPE is fine, they're at capacity, they're monitoring their workforce very closely. Those healthcare professionals have been on the front line since March, and it's been a long 7 months, so they're managing and monitoring that. They have surge plans in place, and they're really doing the things that they need to do that we really put in place a long time ago, back at the beginning of the outbreak, so that we would be prepared to, which was our original intent, to flatten the curve, manage our healthcare resources so we didn't overwhelm our hospital systems, and then continue to do everything we can to protect our most vulnerable. So, we're seeing less vent usage, and we're just doing a better job of treating the patients. But we're continuing to monitor it every day. I don't know, Dr. Padotti, if you want to talk about the timeline that follows some of the increase.
Yeah, I think I would say, just like everything else, right? This is another example of a place where there's a lot of coordination that's necessary between public health, between our healthcare providers who have been working, hard, for patients on the front lines for months now and continue to do that. I think it's an important place where we have conversations across systems, across providers, to understand how we can work together and what we're seeing. And again, just like so many other parts of this response, there's not one single driver here, right? So we know that in some situations, we're seeing people who've delayed care. We want to do everything we can to support Iowans to access the routine care that they need, including staying up to date on vaccines, which includes the flu vaccine for everybody 6 months and older. And we want to make sure that we have those continued touch points, not just in regions or even across the state, but we speak quite regularly with our neighboring states, and with our federal partners to make sure that we're understanding the resources, the needs, and keeping a close eye on what's going on. And it all ties back to, again, the more we can do to follow the public health recommendations, the things that include really staying home when you're sick, maintaining social distancing, using face coverings, and practicing frequent hand washing. The more we can support, each other, right, in making those decisions, those healthy decisions, we'll see that spread decrease, and we'll be able to protect our most vulnerable Iowans as we move forward into the fall.
Governor, are there any hospitals that are at capacity, and are there Iowa patients referred to Omaha and Sioux Falls hospitals?
Well, Sioux Falls are also seeing an increase. So up in the Northwest region, I talked about the tri-state regional capacity, but so they're not going back and forth with the hospitals in South Dakota. But we also, a lot of them are part of larger healthcare systems, Mercy and Unity Point. And then as we've developed the regions, that's part of what we talked about was a surge plan and making sure that if we hit capacity, that we had the coordination with the other hospitals to be able to move patients as necessary. And not yet. Last night when we talked to them, when our team reached out to them, that's the questions that we're asking them. Kay, are you at capacity? What is the bed capacity? Are you getting everything that you need? Is there anything that we need to help facilitate in order to take care of the patients? And those calls are happening daily. You heard Dr. Padotti, the Department of Public Health, the local public health officials, my team are coordinating and reaching out and making sure they're getting everything that they need. They're deciding if they need to, I think they're still able to provide elective surgeries, but if they need to step back, that's part of their surge plan. So hospitals are doing what they need to do to manage the numbers that they're seeing. And I forgot to mention, so I'm glad Dr. Padati brought that up. We are seeing a lot of delayed care that's going, and so that's part of it that they're experiencing right now in the increase in numbers. And then we're testing anybody that goes into the hospital, and that was not being done before. So if you go in for any reason or you go into the ER, they're testing, and so that's also included in some of those numbers as well. I'm not sure when we made that change, but I know we weren't doing it early on.
Different hospitals kind of
Implemented it differently, okay.
Governor, isn't it concerning, though, that, you know, we're going into flu season, hospitalizations have hit their highest point. The White House Coronavirus Task Force has said that Iowa is in a vulnerable position going into flu season because of our increasing community spread and hospitalizations. Yep. What are you going to do to bring down community spread?
Well, it's the same thing that we've been talking about since the very beginning. Dr. Padati just went over it. We've also done outreach to not only community leaders, but pastors. I've talked to most of the superintendents in the region to talk about the mitigation efforts that we need to put in place. Stay home if you're sick. Wash your hands, social distance, wear a face covering, wash your hands often, clean surfaces that are used often. And, we're going to continue to remind people that those are the things that they can do to help us mitigate community spread. And they're doing that. And we just need to continue to talk about to educate and raise awareness and talk about what we can do to bring it down. We are seeing a lot of positive, reflection, things happening in the state too. So Northwest and some of our rural counties are experiencing some high numbers, but Polk is at 6%, Lynn is at 7%, Black Hawk is at 6%, Story is at 7%, Scott is at 8%, Dallas is at 7%. Of course, we want to get those numbers even lower. We'd like to see 5 and below, but they're moving in the right direction, and so we're going to continue to, drive the message and ask people to be a part of it and help us drive down the community spread so that we can continue to keep things open, keep our kids in school, and really, balance the lives and livelihoods of Iowans.
Governor?
You've resisted calls for a mask mandate, saying that you trust Iowans to do the right thing, but some of your own state agencies, DIA, IWD, Alcoholic Beverages Division, have documented instances of business owners and even medical professionals ignoring some of the advice and recommendations that have gone out. So given the threat that those folks pose to the rest of the population in Iowa, do you still think it's a good idea to just trust Iowans to do the right thing?
I do. I have confidence in Iowans. We have processes in place. We are monitoring our businesses and our healthcare facilities to make sure that they're doing the infectious control practices, to make sure that our businesses are adhering, if it's a restaurant or a bar, to the regulations that we have in place. If not, they'll get a warning, and if they don't change what they're doing, then there's a procedure in place to administer a fine, and eventually they could be shut down for so many days. So we're continuing. Businesses have the opportunity to implement wearing a mask as you enter into the businesses, and you see several of them that do that. Iowans are adhering to that. There are individuals that can't wear a mask because of health reasons. So we're going to continue to talk about it. We're going to continue to talk about the importance I have from the very beginning, and we're going to continue to highlight that.
10 people dying every day, so talking isn't working. I mean, as a lot of people would observe, we've had 250 people die in the last month.
And you know what? Do you want to talk
alone.
about the people that are dying because they've delayed care? Do you want to talk about the suicides that have ticked up? Do you want to talk about the kids that aren't in school?
More to stop this.
We are doing a lot, and I'm proud of what we're doing. And you know what? Any death is one too many, and it's heart-wrenching to see the numbers. But I have to balance a lot, and we've got a great team that's working together and working with Iowans and businesses across this state. But there's more than just one side of this. There's a lot of things that we have to take into consideration when we're talking about COVID. And it is the impact, the isolation, it is the mental health and increase in behavioral health. It is the increase in health conditions because people are afraid to go to the hospital. It's the domestic abuse. It's kids that haven't had any eyes on them for now 7 months that are falling through the cracks. You know, it's moms, dads, single moms that are working 3 jobs because they have to go to work. They have to be able to do what they can to provide a living for their family and try to keep their home and keep their kids educated. So it's all of that. It's just all of it. And we have to figure out a balance that not only protects the lives and the livelihoods of Iowans.
Governor, hospitalization rates are an indicator of possibly not enough
I didn't hear the first part of your question.
Hospitalization rates are an indicator of not enough people getting tested, not necessarily that we don't have the testing capacity. Does there need to be more messaging for people to go out and get COVID tests if they've been exposed, if they have symptoms, to get ahead of these possible asymptomatic spread?
Well, you heard how many people will let Dr. Padotti talk about that, but I mean, we've got quite a few individuals that are testing. With Test Iowa, you don't have to have symptoms to be able to go to a site, and that's the partnership that we're setting up with clinics all across the state. I'm not sure if I'm understanding the question. Do you?
I think anytime we have the chance to encourage
Yeah.
messages.
I mean, we talk about it all the time. I talk about it almost at every press conference. We do press releases. We're collaborating and coordinating with our schools, with our long-term care facilities. Early on, we reached out to our manufacturers to work with them so that they could provide some sense of comfort to the employees, so we would know who was positive, who was negative, make sure that we were separating them and providing the appropriate PPE so that they would be safe at the workplace. So, you know, I think we continue to reach out. I've got 2 more clinics coming on tomorrow. We've got probably 3 to 4 that we're working on for next week. So we continue to take a look at the map and see where maybe some of the areas are that may need additional access. But I think, you know, the partnerships with our higher educational institutions has been really good. And so we continue to build those out and make people aware a lot. So, you know, we're not going to stop doing that, but I bet we talk about it almost every press conference that I hold. So, you know, it's available, it's out there. You can't mandate people to go get a test. But I think, you know, you saw, I think that was when the kids went back to school, you had more of them testing because they were aware of the exposure. And so we saw that tremendous spike, you know, and then come back down through contact tracing. We were able to identify, you know, what that was tied to. So I think between the contact tracing and the availability of the test, and it's just getting easier and more accessible all the time with the antigen and point of care, and I think those are probably going to continue to expand. You're going to continue to see innovation and new type of testing be available until we can get a vaccine, and I think, you know, it's just going to continue to be more and more access for Iowans and Americans to get a test. And many people are doing it multiple times, so that's kind of what we were trying to point out on the numbers that I gave you. We have many Iowans that are going back and getting multiple tests as they've been exposed, or if they're going to go see a loved one, they want to make sure that they're, you know, not asymptomatic and testing positive. And so I think you have more and more people, you know, doing that as well.
Governor, you were photographed over the weekend at an indoor Trump campaign event not wearing a mask. What do you say to criticisms that you're not modeling good behavior?
Yeah, well, so you should have been with me the other 12 days. I mean, I was in 12 counties over 2 days visiting a lot of different hospitals and small businesses wearing a mask. We were outdoors. It was raining. They asked if we would come in, so we moved in for a very short period of time. Had the mask when I went in there. I take it off when I speak, but you know, I had it on nearly almost all of the rest of the time. So if you can't, you know, I try to be very careful. If I am within 6 feet for more than 15 minutes, then you should have a face mask on. And so we try to adhere to that as much as possible. Thank you.